In this video, I would like to go over the mechanism of action as well as the adverse reaction of the medications that are used for the treatment of bipolar disease. So bipolar disorder is divided into two types. Type 1, which presents with manic episodes, and type 2, which presents with hypomanic episodes. Now you should know that these patients are prone to the development of depression. However, you must be careful of the administration of antidepressants because it increases the risk of mania. So lithium functions by inhibiting the phosphoinositides, and the adverse effects of lithium includes, for instance, tremor, sedation, ataxia, diabetes insipidus, hypothyroidism. And then in mothers that are taking lithium during pregnancy, their children can develop Epstein anomaly, and I will explain these again in more details. The next medication is valproic acid, which functions by inhibiting the sodium channels as well as by increasing the GABA concentration. And the side effects of valproic acid include hepatotoxicity, spina bifida due to folate deficiency. These patients can also present with thrombocytopenia as well as weight gain. The next medication is carbamazepine, which increases the sodium channel inactivation. And the side effect of carbamazepine is bone marrow suppression, as a consequence of which these patients will develop agranulocytosis as well as aplastic anemia. And then finally, atypical antipsychotics like, for instance, clozapine or risperidone can be used for the treatment of bipolar disease. And these medications function by antagonizing both the serotonin 5-HT2 as well as dopamine D2 receptors. So atypical antipsychotics antagonize both the serotonin and dopamine receptors. And so the side effects include, for instance, increased weight as well as diabetes mellitus because of the weight gain. And then you should also know that clozapine is also associated with agranulocytosis. Alright, now I would like to discuss lithium in a little more detail. So as I mentioned earlier, lithium functions by inhibiting the phosphoinositides, which is a secondary messenger. And lithium has been used in patients with bipolar disease to prevent the relapse by as much as 30%. And then the other use of lithium is in patients with syndrome of inappropriate ADH. So what lithium does is that it antagonizes the V2 receptor in the medullary portion of the collecting ducts. So it can be used for the treatment of the syndrome of inappropriate ADH. But then at the same time, lithium has a very narrow therapeutic index, meaning that there is a little difference between the toxic as well as the therapeutic doses. So for the same reason that lithium antagonizes the V2 receptor, it can be associated with nephrogenic diabetes insipidus as well as hypothyroidism and Epstein anomaly. And then the other side effects include, for instance, tremor, sedation, and ataxia. And so for the treatment of patients with nephrogenic diabetes insipidus, you can provide them with thiazides. And so what thiazides do is that they enhance more excretion of salts than excretion of water. And so since more salts will be excreted by application of thiazides, it would balance out the water loss with the nephrogenic diabetes insipidus. So in patients with nephrogenic diabetes insipidus, since kidney does not respond to the ADH, they would lose too much water. By giving these patients thiazides, you will increase the salt loss, and so you would be able to balance out electrolytes abnormalities seen with this disorder. You can also give these patients amiloride, which prevents the accumulation of lithium in the collecting tubule cells, and so can help with the treatment of nephrogenic diabetes insipidus. And then the final condition that we have here is Epstein anomaly, seen in children of mothers who are taking lithium during their pregnancy. And so this is a congenital condition where the heart defect is associated with the tricuspid valve being displaced downward into the right ventricle. So you can see how tricuspid valve should have been here, but now the valve has displaced into the right ventricle, which is shown right here. An Epstein anomaly is the name of this heart defect that is associated with lithium toxicity. And that concludes our discussion.